Hi there. Welcome, come on in. Get yourself nice and comfortable. And how are you today? Okay. So, you've been having a few problems. Right. So we're going to do a neurological exam today, just to check a few bits and pieces over, to see if we can find out what's going on and see how we can help you, okay? Fantastic. What I'll be doing is I'll be making notes as we go so that we can put a full report together at the end. Is that all right? Great. So before we start any tests or exams, I'd just like to ask a few questions and then we'll take it from there, okay? Great. So, have you got any pain in your back at the moment? Okay. Any pain in your neck at all? Any pain in your head? Headache or on your head at all? And anything along a nerve, so sciatica, anything like that? Okay. Any tremors, any shaking of the hands at all? Any weakness in your muscles or any tension in your muscles? Okay. Any problems with balance or coordination at all? Okay. Any numbness or tingling of the skin? And any changes in any of your senses? So any change in your hearing? Any change in your vision? Any change in your taste? Any change in your smell? And any change in touch? Any slurred speech at all? Any confusion or any changes in mental ability that you've noticed? Okay, that's it for that part, so nice and relaxed. What I'm going to do is start with what do we call mental status, so just seeing how that brain's working. So I'll be asking a few basic questions and asking you to do a few tasks that require a little thought. I thought we'd get that out of the way first, and thereafter it's just lots of medical exams, okay? Great. So, a nice easy one to start with. Your full name, please. And today's date. Next, where are we? So now, could you please count from 0 up to 10 for me, please? That's great, thank you. And now, from 10 back to 0 for me, please. That's great, thank you. Describe for me how you're feeling today. Thank you. Next, spell the word sleep for me. The word sleep. Thank you. And then can you spell the word sleep backwards, please? Thank you. Can you describe for me what you had for lunch yesterday, please? And a favourite toy or game from when you were growing up? Fantastic, thank you. Next, could you please tell me the relationship between these things? Okay, so firstly, dog, cat, rabbit. What's the relationship between those three? What links those three things? Good. Next, car, bus, and bicycle. What links those three things? Next, t-shirt, sock, and shoe. What links those three items together? And then a few things which require movement, okay? So firstly, could you please place your left hand on your right shoulder for me, please? Thank you. And then could you please place your right hand on your left knee for me, please? Thank you. And then finally, could you please show me how you would brush your teeth? So rather than describing it, show me the actions that you would do to brush your teeth, please. Fantastic. Thank you very much. Right, move this to the back. So, next we're going to look at coordination. So, I'm just going to pop on a pair of gloves. because there's lots of tests to do now. Right. Have you done any of these kinds of tests before? Have you had a neurological exam before? Okay, we'll see as we go. Right. So, firstly, I would like you to close your eyes, and then once your eyes are closed, touch your nose, please. So, eyes closed. And if you could touch your nose for me, please. Thank you. And with the other hand. Great. Well done. Open those eyes. So what I'd like you to do next is eyes open this time. I'd like you to touch your nose and then touch my finger. I'm going to move my finger around and you need to just tap it with your finger each time, okay? So touch your nose first, tap my finger, touch your nose, tap my finger. Is that okay? Great. So, ready? So, touch that nose. Touch my finger. Good. Touch your 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 nose. Touch my finger. Good. Well done. Okay. Moving on from coordination, I would like to test your reflexes next. And I'm going to look at your knees and I'm going to look at your elbows. I'm going to use these. Seen reflex hammers before? Okay, so I'm going to start with this one with your knees and I'm going to give them just a gentle tap, just until we can make that reflex work, okay? Great, just stay nice and still for me. So, this knee first. Ready? Okay, little tap. Good, is that okay? Fantastic. And then on this side as well. Okay? Yeah. Little tap, ready? And again. Lovely. What lovely reflexes in those knees. Swapping now to the hammer. Same sort of thing, to take the inside of the elbow. I'm again just going to give a little tap on each side, okay? So if you're happy to just pop your arm into my hand, we'll start with this side, okay? Ready? Okay. The elbow, ready? Good. One more time. Fantastic. This side. Again, if I can have your arm. Ready? Good. And one more time. Fantastic. Well done. Reflex is all good. Okay. Now we're going to take a little look at the autonomic nervous system. And that's simply three things. So firstly, I'm going to take your blood pressure. Then I'm going to have a little listen to your chest with the stethoscope. And then I'm going to look at how your eyes react to the light. Okay. That's the next section for you, okay? Great. So we'll start with blood pressure. Can you use this arm, is that okay? Great. Just going to slip this on, attach it to the machine, and we'll let the machine do the rest. Okay? Okay. So, zip your arm in for me. Thank you. So, plug this into the machine. When I press the button, you will feel the blood pressure cuff inflate. It might get a little uncomfortable, but it won't be painful. And then it will slowly deflate as the machine reads that blood pressure, okay? Ready? Here we go. Good. Okay. Yep, right, let's take that off. Fantastic. Sit that arm out for me. Perfect. Thank you. Let's make a note of that reading. So next, first, listen to your chest. Is that okay? Great. Okay, here we go. So, this will be a little cold. I apologise. To listen on this side first, and then that side, okay? Great. So, ready? Okay, here we go. Fantastic. And then on this side. Ready? Okay, here we go. That's great. Thank you very much. What I'd like to do as well is just take the pulse on your wrist quickly. Do you want this wrist here? Thank you. All I'm going to do is just grab, do a little count. Ready? Okay. Nice and relaxed for me. Fantastic. Almost there. Thank you. Okay. What I'm going to do next is I'm going to cover up your eyes with these. Once these have been over your eyes for a couple of seconds, I'm going to take them away and look at how your pupils react to the light. Okay, so again, covering those eyes, taking them away, and just looking at what happens to those pupils, okay? We'll do it twice. So, ready? Okay, here we go. Good. And one more time. Good, well done. Carrying on with that, I'd just like to shine a light into your eyes. I don't want you to look at the light, I'd like you to look over one of my shoulders, please, okay? What I'm going to do is shine the light in from this way first, and then in from this way, okay? So, looking over the shoulder of your choice. Ready? Okay, here we go. Good. Well done. Good. Keep looking over that shoulder. Good. Well done. Excellent. Thank you very much. Okay, that is that part done. So next we're going to look at some of the cranial nerves. So it won't be a full cranial nerve examination. There are just a few areas that I would like to look at in further detail. Okay? So having just shone a light in those eyes, I would like to have a little look at how you could now follow my fingers around. Okay? Great. So, all you need to do is keep your head nice and still for me and just follow my fingers. Okay? Great. So, this one first for me. Just following. Good. Well done. Very good. Following this one this time. Good. Well done. This finger again is going to come towards you and away from you. If you could just follow the finger once again. Ready? Okay, here we go. And back. Good. Coming forwards again. Well done. Back. Forwards. And back. Good. Well done. So if you could do some facial movements for me now, if you could please raise your eyebrows for me. Thank you. And then if you could frown for me, please. And then if you could close your eyes as tightly as you can for me. Scrunch those eyes up. And then open them. If you could show me your teeth, please. That's great, thank you. If you could smile for me, please. Thank you. If you could puff out your cheeks for me. Fantastic. Next, just going to see what you can hear. I'd like you to close your eyes for me, and I'm going to make a sound next to each of your ears, and you need to tell me if the sound comes from the left or the right, okay? Great, so eyes closed for me, no peeping. Okay, so where does the sound come from? Ready? Good. Good. Well done. Where did the sound come from? Good. Couple more. Well done. Last time. Good, well done. Open your eyes. Fantastic. Next, we're going to use a tuning fork and just place it next to each ear to begin with, and then place it on top of your head to see how the sound travels down to those ears, okay? Great, so each ear, and all we're hoping for is that it sounds the same in both ears. Ready? Okay, here we go. Okay, this ear next, ready? Okay, how did that sound? Similar in each ear? You could hear it okay? Okay. Next, I'm going to strike the tuning fork again, and this time put it on top of your head, and you will feel the sound travel down into your ears. Once again, we're looking for something similar in both ears, okay? Right. Ready? Okay, here we go. Okay, just like to do that one more time, please. Ready? Okay, so how was that? Did that sound similar in both ears? Okay. Okay. Thank you. So next, I'd like you to stick out your tongue and wiggle it for me, please. Thank you. Next, what I'd like you to do is stick out your tongue, and with your tongue out, tell me your name, please. Good. Fantastic. Next, I have a little scent bottle here, and what I would like you to do is I'm going to take off the lid. I'd like you to have a little smell and tell me what scent is in here, okay? It's a very common scent, shouldn't be any problem for you, okay? Ready? Great. Here Here we go. Nice deep breath in through the nose for me. So what scent was that? Yes, that's right. Well done. Next, if you could shrug your shoulders for me, please. Good. And if you could turn your head from side to side for me, so turning first to the left, back to the centre, then to the right, and back to the centre for me, please. One more time. Thank you. So finally, we're moving on to your sensory nerves. I'm going to look at this in two ways. So firstly, I have here some globes, okay? One is warm and one is cold. And what I'm going to do is I'm going to place the globe onto your hand, and you'll need to tell me if it is warm or cold. So, hands out like this. And you just need to tell me if it's warm or cold, okay? So, I think both hands out for me, like so. And then we'll do one at a time. So, warm or cold? Ready? Okay, here we go. Was that one warm or cold? Good. Next one. Was that one warm or cold? Good. And again. Warm or cold? Good. A couple more. Warm or cold? Good. Last one. Warm or cold? Great. One in each hand, just to tell the difference. One felt warm, one felt cold, yes? Good. Fantastic. Right. Finally, what I'd like to do is a little sensation testing on your face. So we have a soft end and we have a wooden end. I'm going to touch around your face and I'd like you to tell me whether it is the soft end that's touching your face or the wooden end that's touching your face, okay? Great, so eyes closed for me, please. I'm going to start with your forehead, then go on to your cheeks, to your nose, and finally your chin, okay? Just so there's no jumping. So eyes closed, ready? Here we go. Good. Well done. Good. Good. Moving on to your cheeks. Good. 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 Your nose. Good. Very good. Good. And finally, your chin. Good. 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 You can open those eyes. Okay. So, that's all of the tests complete. Everything okay? Was there anything there that worried you? Anything that came up differently to how you thought it might come up? Or was everything okay? Do you have anything at all that you'd like to add that I can include in my notes? Good. Right. So what I will do is I will go away and put all of this into a report, which I will then send on to the relevant departments. There are one or two areas where I think we might just ask you back and do some further investigation, but I think that's positive because you came here today because you were having problems and we might be well on the way to identifying what they are, okay? In the meantime, please try not to worry, and what will happen now is we'll get back in touch once everybody's had a chance to chat these through, and we'll let you know exactly what we're going to do next. Do you have any questions for me at all? Okay. Well, thank you for coming in today. Thank you for being patient and working through all of these examinations so well, and I look forward to seeing you again soon. Take care. Bye-bye.